is Houston Newsmakers with Cambrell Marshall.
Good morning and welcome to this very packed special edition of Houston Newsmakers as we begin with Congressman Dr. Babin representing the 36th Congressional District. Good morning to you, Congressman. Good to see you, sir.
Good morning. Great to be with you, Cambrell.
Let me ask you, what is your opinion about how the United States and our region, specifically your district, how are we doing in the response to the pandemic in your estimation?
You know what? We're holding our own. We really are. I think we're doing well. We certainly have our share of cases, and we're on the upswing. We have definitely not peaked. I represent 9 counties from southeast Harris County, Houston, all the way over to Louisiana, and the 9 counties in between. And I think we're weathering the storm pretty well. Our folks are doing the right things. Our local elected officials, our emergency management people, our healthcare folks. And I've just been fielding a ton of telephone calls and trying to find PPE, masks and cartridges and testing kits and staying on the telephone constantly with the president's team, the governor's team, and a lot of our local folks. And just working from home. That's where I've been for about 3.5 weeks now.
Let's talk about the latest stimulus efforts and the need for even more. The latest unemployment numbers are just tremendous, and we kind of knew that was going to be the case. Clearly taxing the system set up to help them. Americans need more. How much more do you think that it's going to be necessary to help Americans get back on their feet in terms of the stimuluses that are being talked about now?
I think we could certainly use a phase 4. There's no question about it. And I serve on transportation and infrastructure, that committee there in the House of Representatives, as well as the Science and Space Committee. And I represent Johnson Space Center. But yes, we could certainly use more funding to help our folks. And quite frankly, the most popular aspect of phase 3, or the CARES Act, was the PPP, or the payroll protection program. And now we're out of money. We ran out of money yesterday. Unfortunately, we knew this was going to happen. Secretary Mnuchin, Vice President Pence, we were all on a conference call probably over 2 weeks ago. And we knew we didn't have the $349 billion in this, and it's the most popular thing we have. For small businesses and keeping their employees paid, even though they're not working, keeping these businesses flush with some funds so they don't go out of business. And whenever we stand this economy back up, Cambrell, that these businesses can get right back in the swing of things. Unfortunately, we're out of money. We tried to put another $250 billion in, and I don't want to don't get me wrong, I'm not here to get partisan or anything, but we had a very clean bill. The leader of the Majority Leader McConnell in the U.S. Senate had a very clean bill, about 3 or 4 sentences, and it simply just said we're adding $250 billion to the Paycheck Protection Program. And it was blocked. It was blocked by the Democrats. They wanted to add a whole bunch of extraneous things that, quite frankly, didn't have anything to do with COVID-19. And so here we are.
Right.
We've got millions of more small business people that would like to partake of this program or have already applied with their local lenders, and we've got no funds. So we've got to have both sides sitting at the table so that we can get another $250 billion in there to help people.
I think you're probably optimistic, like a lot of people. It'll get done. It's just taking a little longer than it wants to be. The president talked this week about getting the country back to work, and he talked about the timetable to try to do it. I don't think anyone denies the need to get people back to work and normalcy as soon as possible. What concerns do you have about getting back to work maybe too soon at the risk of more COVID-19 cases impacting the communities?
Well, you know, I practice dentistry. I'm a healthcare provider. I practiced dentistry for nearly 4 decades, 36 years, and I'm still licensed, as a matter of fact. I can tell you that if we go back too soon and we're not careful and we start, not paying attention to isolationism and things of social distancing, hand washing, personal hygiene, then we're in really great danger of slipping right back into a COVID epidemic again, a pandemic. And so I think the president is certainly right, because as we see, we're far below the prognostications by a lot of the professionals. Said we were going to have 1 million Americans possibly fatal with fatal disease, and we're not even close to that. But I will say this, Cambrell, because when people are at work and they're at home and they're isolated, bad things can happen to their psyche, to their psychological outlook.
And we're going to talk more about that in our Newsmakers Extra, Congressman. We're running out of time now. That's going to be on Newsmakers at click2houston.com. Thank you for what you do, by the way. Looking forward to continue our conversation on click2houston.com. Just ahead, what will the financial toll for the city of Houston be with all of this? Tricky budget in place, pandemic throwing a major curve at balancing it. City Controller Chris Brown with possible terrible impacts of the city. We'll talk about that. The Houston Newsmakers continues.